Good afternoon, everybody. Thank you very much for joining us today with Healthmonics with our fireside chat with the American Psychological Association. Today, we're going to have the impacts of COVID-19 on mental and behavioral health practices. We have joining us from Healthmonics, Nisha King, our marketing director. We have from the APA, we have Vale Wright and Lynn Bufka. We are going to go through a couple of things first prior to handing it over to them. The first thing is in your GoToWebinar widget that you have here, you have the ability to ask questions to us. If we have time at the end, I will go over the questions with them. Otherwise, if we don't, you will get an answer shortly after the webinar sometime by the end of this week. The next thing is that we have a couple handouts for you, one with some information about the MBHR, and another is going to be the slide deck from this presentation today. We have a couple of slides that we'll be working through prior to a more open chat with our guests. The first thing I would like to do, though, is we have a couple of polls, and I want to open up the first poll for everybody, and if you don't mind, please answer within the next minute, and then we can get started. Give it another 15 seconds. All right, close that, and I'll share this so that everybody can take a look at who we're talking to today. We have here 33% are from providers or assistants. We have some consultants on here, as well as office managers and quality managers. I could have kept the other category out and made it even easier. So, without further ado, let's move it over to our team today. Nisha, go ahead.
Well, thank you everyone for being here today. I want to welcome our guests, Vale Wright and Lynn Bufka. We met about this time last year, right when we were in the midst of the pandemic, to understand what people are dealing with, how they are coping with things, and really just wanted to check in and see what the update is across the nation. So if you guys could start there, just give us an update on where we are today.
Thanks, Nisha, and thanks to everybody for attending, and of course for inviting APA to come and participate. We're always excited and happy when we get to continue our partnership with Healthmonics. Yeah, so I'm just going to start with some really brief slides, just sort of laying out the landscape, and this slide is probably a bit unnecessary because we all kind of know where we're at, and I'm not sure we always need to be reminded of the fact that we are well over a year into this pandemic, and it has totally disrupted all of our lives. And, you know, I think there is some light at the end of the tunnel. We have 3 effective vaccines that are rolling out, but the challenges, of course, is that many of the uncertainties that we've been living with for last year will continue on even as we start to move forward. And as we switch to the next slide, you know, I think it goes without saying that the pandemic has really impacted all of us in our physical lives. That seems to get the majority of the attention, but we also know that it's having a huge impact on our mental and behavioral health. So this slide is from our recent Stress in America survey that came out in September. We do one every year where we ask Americans to rate their stress. And in this one in particular, we ask them to rate their mental health. And what we're seeing is that nearly 1 in 5 adults say their mental health is worse than this time last year. So that's really as a result of the pandemic and everything, of course, that came along with the pandemic, whether it's the economic crisis or the racial strife. And when you look at it by generations, it might not be surprising to many on the call, but younger adults are reporting significantly worse mental health. And this really coincides with stress levels as well. So we always see that younger adults compared to older adults report higher levels of stress. And as we switch to the next slide, we'll be able to see kind of what is it that people are reporting. So this data comes from the CDC, and this is from this summer. And what we're seeing is increased reports of anxiety and depression, trauma and stress-related symptoms, substance use, in particular alcohol use, as well as suicidality. And there's some mixed results about what the rates are for completed suicide, but clearly there's a lot of pain going on as a result of the pandemic. And while these results are from last June, more recent reports suggest very similar findings. And as we look on the next slide, that aligns with the data we're finding from our providers as well. So we surveyed our psychologists. We're going to show you several slides from that survey. Lynn's going to take most of them, but from this one in particular, I wanted to highlight that when we asked psychologists, what kind of referrals are you getting? What are people coming in with? You're seeing the exact same things as that previous slide. An increase in anxiety disorders, depressive disorders, trauma and stress-related disorders, and one we haven't talked about, but sleep-wake disorders. So people really reporting disruptions in their ability to fall asleep, to stay asleep. And so, again, we're really seeing a lot of alignment about how the pandemic is impacting our mental health. And so if we go to the next slide, we're also going to see that while nobody is immune, I think, to the mental health impacts of the pandemic, certain groups are certainly more vulnerable than others. And in particular, what we've found over the last year across many different resource sources are that parents with children under the age of 18 are reporting high levels of stress and mental health problems. Frontline workers and essential workers, particularly healthcare workers, are reporting increases. Individuals from communities of color, as well as young adults. And some of the young adults are really some of our most vulnerable. And if we go to the next slide, I'm going to show some really recent data that's come out in the last year since the pandemic. And what we're finding is, again, high rates of anxiety, depression, PTSD symptoms, even among children. And from some really recent claims data, so billing data, which is interesting, suggests an increase in intentional self-harm, overdoses, and substance use in children from 13 to 18. That's really young. And for children even younger, 6 to 12, there's been a reported increase in obsessive compulsive disorder behaviors and tic disorders. So kids are really being impacted by the pandemic, whether that's the school closings or a variety of different stressors that we know that they're experiencing and disruptions to their routine. And then quickly, as we go to the next slide, what we're seeing now is I think more media attention than we have ever in the past. And I don't think it's hyperbolic to say that we really are in the midst of a mental health crisis if we don't start addressing the impacts that the pandemic and everything associated with the pandemic is having on our population. And so with that, I'm going to turn it over to my very favorite colleague, Lynn, who's going to talk about how all of this is also impacting the way that practice is occurring. Lynn, you're muted.
Gosh, I've been so good about not doing that. It's because we're on GoToMeeting instead of Zoom or Teams that I messed that up. Thanks, folks, for your tolerance. I mean, it wouldn't be a webinar if somebody didn't have to say, "Oh, you're muted now." So within what we're seeing among our providers, and we've surveyed our members periodically over the course of this past year, we're finding that the majority made some transition to telehealth. Many have switched to a primarily, for some time period, we're a primarily telehealth only kind of practice. So you can see from the data here that we have two different time points. You see dark green, April and May, and the lighter green, a little more teal, September, October. So you're seeing more people are returning to some in-person services or are doing primarily in-person services, but the majority are still primarily telehealth only or a significant portion of telehealth. And we anticipate that that is going to continue post-pandemic. There's reasons for that's going to be the case in terms of convenience of telehealth, in terms of the benefits that it offers towards people. And on the next slide, you'll just see some headlines about what we know. We know that telehealth is effective It works across a range of populations, different age groups and conditions. We don't have enough information to reliably say telehealth always can be done with this group and should never be done with this group, but we're beginning to see some patterns and practices, right? Many adults in outpatient psychotherapy and outpatient mental health situations do just fine and can be very successful in receiving their services via telehealth. There's a question for, as conditions are more serious or working with children, that in-person may be the preferred means of delivering care. And certainly in some larger healthcare settings, for instance, in hospitals, rehab facilities, there are times when you prefer in-person over remote care. But the option for having telehealth as one modality for providing care is fabulous. It's behavioral health fits very well with that kind of providing services and really gives greater opportunity to meet this tremendous mental health need that we're seeing across the country. We asked our members if they're seeing changes in the number of patients that they're seeing since the coronavirus pandemic. One of the things that we don't know with some of this data is how much of it is in terms of, say, number of referrals. If people are having a smaller number of referrals because they are so busy and they have huge wait lists and so now they're not getting referrals, or if they have selectively chosen to reduce the size of their practice. But what you're seeing is, in general, people have the same number of referrals or more. They're having the same number or fewer of cancellations, and their overall number of patients is the same or more. So there's been greater use of mental health services from psychologists and greater effort on the part of psychologists to try to meet that mental health need. We also were interested in knowing about the stress level of psychologists. Vail presented some data early on about stress in the overall United States population. Psychologists and other healthcare providers are not immune from stress. It is hard, no matter how ideal your circumstances are, to make a huge pivot in how you live your life and do your work because of a pandemic. It was not a pivot that people chose. It was a pivot people needed to adapt to. So some psychologists are truly on the front lines of the crisis right now, whether it's working with individuals who are experiencing more severe, more distress, kinds of mental health conditions, or supporting coworkers working in settings where people are being treated for COVID or recovering from COVID or in long haul COVID. We have a number of psychologists and other mental health providers in those kinds of settings. We would anticipate, like other healthcare workers, that we would see an increase in stress there. But for psychologists who perhaps are not as engaged with the pandemic itself, they're still living their lives and providing services in the course of the pandemic. And we're seeing them reporting higher levels of stress as well. If you look at this, we've got almost close to 50%. Over 40% of psychologists are telling us that their level of stress is at a 7 or higher. And that's a fairly significant range of stress. You know, in Stress in America, we're usually somewhere in the 5 range, maybe somewhere between 4 to 6, right? 7 and higher is one that we're concerned about as a significantly high level of stress. And when we look at surveys of psychologists from a decade ago, while they were talking about the stress of juggling many things that they do in order to provide good care, work-life balance, they weren't talking about a level of distress quite like this. So this is concerning that psychologists too are experiencing this level of stress, but we're also working and encouraging psychologists to do the things that they need to do to take care of themselves so that they can continue to provide superlative services at this time. And that would apply to all healthcare professionals. As difficult as it is to do what you need to do to manage stress and distress as a healthcare provider, it's essential in order to provide good care to the people that you're treating.
Great. Thank you, Lynn. 1 second before we get on to our next page, I want to jump in and do our next poll. And the question here for this next poll is, where would you rank your level of stress? So if you don't mind taking a minute here, we have 2 polls that I'm going to do in succession, and then we'll be done with polls for today. All right, give it another 10 seconds or so if you don't mind. Please answer. All right. Great. So I'm going to share this poll with everybody right here. It looks like everybody's right in the middle. Most everybody in the middle. A couple people are very little stressed. I'm going to ask you to help me out. And then we have some people that are very stressed as well. So thank you for helping with that. I'm going to jump right into the next poll real quick. So the next question is, what is the level of stress you've observed from healthcare professionals as a whole? So we're going to launch that one in there. Another 5 seconds. Great, thank you for participating in that one. It looks like everybody thinks other people's stress is more than their own stress, which is very interesting from my findings. Over 50% say people are very stressed. So I'm gonna get rid of that and gonna turn it right back over to our guests.
Well, thanks everybody for participating in the polls. I suspect that the results for the second slide are more consistent with the fact that several, a good number of the audience are not direct healthcare providers, but are talking about what they're seeing among colleagues. And when you look at this, here's what our members are telling us back in September about how they've been able to practice self-care or not as the pandemic continues. This is fairly consistent with data that we have even from a decade ago, that psychologists have generally done okay with self-care, really understand the need to maintain a positive work-life balance. We're starting to see more people talking about feeling burned out back in September, but the one that's really concerning when I think about the overall well-being of the population is how the people who are saying, I've not been able to meet the demand of treatment from my patients, that 30% are saying that they agree or strongly agree with not being able to meet the demand of treatment from my patients. Well, I work full-time at APA, do a little bit of clinical work out of a practice in the greater DC area, and I know our wait list there is incredibly long because we've had many returning patients come in because the pandemic has made it difficult for them, in addition to new patients coming in. I think this is true for places around the country in terms of mental health care. Yet at the same time, as Dr. Wright told us early on in the presentation, there is a huge need for mental health services right now. So we really need to think about how do we foster well-being among everybody providing services so that all of us, all individuals in that category, are then able to work on it with the people that they serve on an individual basis, on a community basis, nationally. And of course, the first thing is, what are the foundations of mental well-being? And I'm sure you've all heard and seen this 100 times in the past year, but I'll tell you, every time that Vail and I prepare to talk about these kinds of questions, we are reminded that you have to have good nutrition and hydration. You have to have adequate sleep. There has to be regular activity. You have to have social connection, even if it's through the computer and the way you're connecting with people, that those things are really our foundation for well-being. And it always serves as a moment for me to pause and check in and see how I'm doing in that domain. Once I've established that my foundation's okay, I look at these domains of well-being. I'm thinking about my physical well-being, my spiritual well-being, my occupational well-being, my emotional well-being, social well-being, intellectual, all of that. That's sort of like the next level of taking care of ourselves. So the strategies for self-care that one person might employ or another person might employ may vary, but we really encourage people to think through to these domains, to think about these domains and ensure that needs are being met and to make adjustments as they can, whether it's in their work settings, to think about our are my intellectual needs being met, my social needs, my emotional needs, whether it's in home settings, whether it's in social relationships, but all of these domains factor together. And we think it's really critical just to remind everybody to do a little self-check on that. And if you're in a position where you're a manager or overseeing a team, to really ensure that your team is also cognizant of these domains and has opportunities that are appropriate for the work setting to be thinking about that and moving forward in those arenas as well. So that's the part we're going to stop and turn into some Health Monix information and an opportunity for a question discussion following after that.
So I have a few questions before we jump into the MIPS conversation. You talked a lot about children and how they are being massively impacted by the pandemic. How are pediatricians working with mental and behavioral health professionals to kind of close the gap? Are there any changes in terms of helping them quickly get the services that they need?
Yeah, I'd like to hear sort of Lynn's take on this. My first thing I'll say is we know from other research, not necessarily specific to children and peds, but from broader research that people have put off seeing the doctor during the pandemic. People have really put off routine checkups, and I would imagine that that has a trickle-down effect into the pediatric office as well. So I think that what the unintended consequences of that is that there are probably children who are not getting screened by the pediatrician, and they're not in the school, so they're not getting screened in the schools either. And so I think that for at least during the height of the pandemic, there were probably a lot of children that didn't have eyes on them around their mental health. And parents who I'm sure are doing the best they can are also juggling their own mental health while trying to help kids e-learn, while trying to work from home themselves, while trying to adjust to a new routine. So I think in some ways it was probably the perfect storm when it came to children's mental health during the pandemic. But now as things start to open up, I do think ideally changes can be made and that pediatricians and pediatric psychologists can start working more closely together. But I do think we probably need a comprehensive plan on how to do that.
You know, and there are a range of models for this in place. So you have, in some places, you have psychologists or other behavioral health providers right in the pediatric office. So that if someone comes in for a well child visit and some behavioral mental health issues come up, there's someone right there with the expertise to talk with the child, to talk with the family. This is not the norm. This is not what happens in the majority of pediatric offices. You know, good at best, you have some good referral sources from the pediatrician. You may have somebody who's located in the same building, definitely in the same community, but it really is most helpful when you can have those connections right on site. That applies to adults as well, but it's particularly useful with children because pediatricians and physicians are asked to deal with all kinds of things and have broad expertise, but may not have the specific expertise to deal with the range of mental behavioral concerns. So there are many psychologists and other providers who work very closely with pediatricians. We would love to see more of that because we think that's a good way to ensure that children are getting the services before problems become crises, before problems become so entrenched that it requires more intervention. The same is true in school systems as well, to have psychologists really embedded within school systems to work closely with teachers who are picking up on concerns around mental health and able to work with teachers to identify what the concerns are or to get students into more appropriate care, because many common mental and behavioral health issues that children demonstrate can be addressed fairly readily in psychotherapy, as many people on the webinar know. But you're going to have, as I often talk to patients about it, the farther you walk into the woods, the longer it takes to come out. The same is true if you're struggling with a mental health problem. The longer it's been there, the more those patterns have developed, the behaviors have become daily, and the emotions have become a significant portion of how you function, the harder it becomes, the longer it takes to unwind all that. So the more that we can do to link pediatricians with appropriate providers from the get-go is going to be essential.
Thank you. As we think about providers in this environment, struggling to keep up with the demand and meet the needs, all while trying to keep up with MIPS reporting, what can you share with us about how they're juggling that? Are we seeing people kind of back away from that, continue with what they've normally been doing? What can you share about that?
Yeah, I think it's been a really challenging time when it comes to MIPS reporting and quality reporting and any sort of measuring of outcomes right now during the pandemic. In part because there's a lot of confusion. It's already a pretty new program for psychologists, which is and other behavioral providers, and then you start adding changes on top of it, and of course that gets confusing. And then you add exemptions, which of course are meant to, help the provider not be overburdened, but again, it creates a lot of confusion and a reduction in reporting, which then could set you up for challenges later, right? Part of what makes reporting more successful is the consistency of it. And so when you have disruptions to that consistency, it can be hard to get back on track. And then you add the telehealth component to it. So we already were, when you have, say, for example, you're trying to incorporate patient-reported outcomes, and maybe you have like a GAD-7 scale that you want people to fill out, and you have them in your office do it in person. That's a lot easier than trying to adapt it for telehealth. Now, there are ways to do it. There are ways to share screen, and there's ways to read these questionnaires out loud and have them report, but it does take some creativity, and it takes a little extra effort. So I think those are some of the challenges we're hearing people reporting. I don't think they're insurmountable, but they do make it something that was already pretty challenging, even more challenging to be effective at. But at APA, we're trying to provide additional resources to help MIPS reporters really be successful when it comes to how you measure quality during the pandemic. And so we encourage, providers who are part of NBHR in particular to reach out to us and to reach out to Health Monix to really help, troubleshoot how to be the most successful you can be.
Perfect. I think this is a great segue into our next section, which we'll be talking about MIPS tips and tricks. So I'll take it away, and Mike, you can take over.
Great. Just a couple slides, nothing too much today, but I at least want to go over a little bit because this is Health Monix and this is what we do here. So a couple things about 2021 reporting that everybody should know about. This year, the minimum threshold to avoid the penalty has increased all the way up to 60%. This is not very easy anymore. There is no easy way out. You really need to participate, take a look at it from the beginning of the year and understand what you need to do moving forward. Next year even becomes harder as they move it up to 74 points is the estimated number, and we've even heard higher for where we're going to be when it comes to avoiding the penalty. As psychologists go, though, you are in a good position because you get to avoid having to do two of the program's cost and the PI, which are much harder, and you can concentrate almost fully on the quality portion of MIPS. One tip and trick here that I have is the benefits of group reporting. There's a potential for increased return on investment, measure optimization. So some of these smaller measures that have specialty patients involved in them can really help you do well without overburdening your team with answering questions on every single patient that walks in the door. High performers aren't penalized, so they can still get their own individual score. You can report both scores to CMS, and the high performers will get their score, and then anybody below the group score will get the group score. So here's a quick example here, updated for 2021 information. They are saying that there could be a increase of up to 7% in your incentive in 2023. So if we take a look at the difference between having two eligible providers and having about $160,000 in Medicare charges, you could see the incentive would be $11,200. Vendor costs about $900. And then you can see the estimated returns about $10,000. But now if you take into account that you have 15 providers and the rest fall under the thresholds, and you're at about $1 million in Medicare charges in 2023. And remember, it's 2023 data. So if you expect your organization to grow, that number is going to increase as well. So the estimated incentive at 7% is $70,000. And after the vendor cost and fees, you're looking at a return on investment of $63,000. And if you really think about that, that's the cost of having an employee or a part-time employee work on this almost full-time. And it might be worth doing to increase that score, because there are obviously other parts of MIPS scores that can help you when it comes to being able to attract private payers, as well as patients when they're taking a look at your physicians compare and being able to see where you rank compared to your peers from a click quality standpoint. Another little tip here is to look for measures that are not topped out. So topped out measures are either capped at 7 points, or that you have to score a perfect score to get a 100. So those are those measures of median performance is greater than 95%. So those are the measures that a lot of people are doing. And after a measure has been topped out for 3 years, it's going to be removed for the 4th year. So a lot of your measures that were back in the days of PQRS, you'll have the ability there to take a look at them growing out. As you can see, for instance, your falls risk and documentation of current medications are pretty important ones that we see on the therapist side and the psychology side of the business that are topped out now and are harder to get really good scores on. And the last thing I want to go over today is the ability to find extra high priority and outcome measures. So there's bonus opportunities in there. You don't want to get stuck with just 6 measures at the end of the year if you don't have your scores out there. So take a look at 8 to 10 measures in the beginning of the year, track them from the beginning. And if you report additional outcome and high priority measures past your one that's mandatory, you can get bonused on it. The important parts that you must meet are that the measure needs to have a 70% completion rate to get a bonus point, as well as they must meet the 20 patient case minimum and have at least 1 patient meet the measure for them to become eligible. Any outcome or high priority measure beyond your top 6 will not receive any achievement points, just the bonus points. And that's maximized at 10%. So while every point counts this year, it's really important to take a look at things like this so that you can really maximize your score. So you could ask me any questions here. We have availability. We have a whole team here that are here to answer your MIPS questions. You could give me a call or reach out to the contact at Healthmonics, and I'll get those emails as well. So I'm done for my part, and I'm going to throw it back to you, Nisha.
Awesome. So at this time, we'll take any questions that our attendees might have.
All right, not many questions coming in right now, but if you have questions, please ask away. Otherwise, I'd love to find out more about what you think changes are coming, Val and Lynn, in the near future on the MBHR side and using a registry to report MIPS, and what you see coming down the pipeline as changes are coming in. We could start there. That'd be great.
Sure. Well, as CMS continues to evolve and change the program, it becomes increasingly more complicated to be successful. And I don't see how you can possibly not be successful without, but how you can possibly be successful without using a registry, because of the functionality that it provides and helping you know where you have successfully hit certain benchmarks and where you haven't. So I do think that as a tool, it becomes increasingly important as the program becomes increasingly complex. And in addition, as CMS continues to try to streamline and make the measures more meaningful and more specialized, MBHR is then in the position to really utilize our expertise at APA to align with what CMS wants. So as they move to things like MIPS value pathways, which is these sort of specialized sets of measures. We can work with CMS to create, for example, an MVP for long-term care settings, as one example, or an MVP that's specific to neuropsychologists, so that if you're a neuropsychologist wanting to report MIPS, you could go straight to this core set of measures and know that those are the ones that you and your practice can report on in order to be effective for MIPS. So I think that's really where the registry and where MBHR in particular have its value for the practice of psychology, as well as the other behavioral health providers that utilize it as well. And then I think with our partnership with Healthmonics, we're always trying to, again, improve the functionality and make sure that it really does work for the different types of work that psychologists and behavioral health providers do. We're not physicians. We don't operate in the same way. And we need to make sure CMS, one, understands that, and that we have a product that really reflects the unique kinds of work that we do. So I think those are all the things that, certainly from APA's perspective, that we're trying to keep our eye on.
Great, thanks, Vail. A question did come in about telehealth, and it looks like numbers across the board for telehealth have decreased, but not gotten back to where it was prior to the pandemic. How do you see telehealth and the impact moving forward?
Yeah, so it's interesting. So we are seeing reductions in telehealth usage in everywhere except mental and behavioral health care. And mental and behavioral health care, the numbers for telehealth are actually pretty stable and have stayed pretty high. I think that speaks to, and I'd love to hear Lynn's take on this too, but I think in part speaks to how uniquely aligned telehealth can be with the kinds of work that mental behavioral health providers do. I mean, it just really is well suited for it. Similar to the discussion I was just having about physicians, we don't need people to come into the office for physical exams. The work that we do really can lend itself, by and large, like Lynn said, not every single case for every single situation, but by and large really does work well via telehealth, and we know it's effective. So it seems like a lot of those numbers have stayed stable. But we're also in the process of doing another member survey where we're going to ask psychologists these kinds of questions. How much are they still doing telehealth? So stay tuned. If you're interested, we post all this on apa.org.
Yeah, absolutely. We're seeing that psychologists and other mental behavioral health providers want to continue providing telehealth because they see the benefit. There's the benefit not only in terms of convenience for patients. Many people, when they're in therapy, it's a weekly commitment. That can be really hard for individuals to adjust their schedules so that they can physically get to a location, to commit to the 45 minutes of a session and the time it takes to, wait before you go in, then paperwork as you head out, and then return to wherever you need to go. For most people, we're looking at a minimum of an hour and a half for a psychotherapy appointment, and that's every week. And therapists aren't available at 5 o'clock, 6 o'clock, 7 o'clock for every single person that they see. So you're trying to work this out around work. So that's one of we know patients are telling us it's incredibly convenient. They want to continue with telehealth. That's not true for all, but that is true for a lot of people in outpatient care. We also know that clinicians are saying it's really convenient too. It gives them greater flexibility on when they can offer hours of care. They might be able to provide care to somebody at 8 in the morning when otherwise getting to an office would have been very difficult for both parties. So we're just seeing a lot more convenience with the providing it and the assurance that the care is still quality. So I think that's one of the really wonderful benefits here. The challenge is that integration I talked about with pediatricians, right, becomes harder when one of your colleagues is virtual and one is in the office. So we're trying to figure out what are the best models for how to integrate virtual with on-site kinds of care. But definitely anticipate it's going to continue because it's both consumer demand for telehealth as well as clinician recognition that it's filling a valuable need and is very effective.
But I think the other challenge that I want to bring up too is we knew that telehealth was effective before the pandemic, but less than 10% of providers were using it because of the scalability issues related in particular to a number of barriers and restrictions to really effectively put telehealth in place. And because of the pandemic and the public health emergency, many of these restrictions were at least temporarily removed. which is a good thing. So things like being able to see the patient in their home, the originating site removal, barrier removal, reimbursement parity, being able to reimburse for audio-only services for populations that either don't have access to internet and devices like older adults and rural adults, but also just as a backup for when your internet fails, right? So being able to be paid for these different types of services have been critical to our ability to scale up and actually do telehealth to the extent that we're doing it now. So going forward, it is going to be really important that the policymakers and the payers keep the appropriate restrictions out of the picture so that we can effectively continue to deliver telehealth, both as we ride out the end of this public health emergency, but again, what will healthcare look like afterwards? And so I think those are some of the things we need to be thinking about as well when we think about the future of telehealth.
Great. Thank you, Val. And, following up on that, you mentioned earlier there was a couple news clips that were on there about mental health crisis and COVID-19. And, I know for personally, I've been vaccinated and I'm starting to feel the world opening up a little bit and changing a little bit. And outside of telehealth, the impact of the summer months coming and the impact of the world reopening, are you seeing a change of why people are coming to mental health providers, or is it a lot of the same things that are just kind of lingering from the pandemic?
We're still seeing lots of depression and anxiety, right? That's what a lot of people in terms of outpatient psychotherapy have traditionally come in because they're feeling depressed, they're feeling anxious. It's interesting, as somebody sort of data interest, geeky, dorky, we are seeing more OCD, which is kind of an interest, especially among kids. So obsessive compulsive disorder, which in some ways makes sense, right? Like we've been told to fear this invisible virus. So wanting to check and be clean and try to take precautions. And how do you know when you've done enough? That's consistent with some of the kinds of concerns and behaviors and thoughts that arise with OCD as well. But you're also seeing challenges in other areas. Eating disorders are definitely a challenge right now because the kinds of patterns and consistent routines that individuals had pre-pandemic were completely disrupted. And the kinds of things that people may do to cope with stress and anxiety may change because of that. And so you may be turning to food in different ways or trying to control aspects of your environment that feel controllable when so much else doesn't feel controllable. And those are things that we often see with eating disorders. And then as Val pointed out on that slide, sleep-wake disorders. So that sleep challenges are often accompany anxiety and depression, but they also can be problems in and of themselves in a rise to that point. So we're seeing more of that as well. It is definitely a challenging time for individuals, when your resources for coping with the world being upside down are diminished, it becomes that much harder then to deal with the threats and challenges coming your way.
And I think what's unique to this point in time period as we again start to kind of move out of the depths of the pandemic is some survey data that we collected at APA that's found that almost 50% of adults reported some level of concern about returning to life pre-pandemic, that there was some reentry anxiety. And I think that can be a variety of different things. I think one is people have probably gained some things during the pandemic in addition to the losses. People don't want to go back to commutes to work and maybe liked that they were able to spend so much time with their family without having to run from here to there. So I think that's part of it. I think, the uncertainty that Lynn alluded to is still there. Everything is going to look different going forward. We just don't know exactly how, but the workplace is never going to look the same. Healthcare is never going to look the same. Retail is never going to look the same. Like things have altered for the rest of our lives in pretty significant ways, which can drive anxiety. And interestingly, Mike, to your point about getting vaccinated, what we found was in the survey, those who reported being vaccinated were no less anxious than unvaccinated individuals about returning and reentering into the world. So the vaccine, while obviously critical to us getting back on track, isn't in and of itself an anxiety remover. necessarily. I think we really need to be thinking about, again, what are the things in our control and how can we use those to make smart decisions as we continue to navigate an uncertain future.
One of the things that I hope all of us in the public will do is really think about what maybe we've learned about ourselves over the course of this year and use that to make decisions going forward, right? So we've seen stories about people who are socially anxious, who have been loving the pandemic, right? They don't have to be out there interacting with the world as much. But as somebody who works with anxiety primarily, I never want somebody's anxiety to make their decisions for them about what they do in the world. But I do think it's an opportunity for individuals to think, do I really enjoy all that social stuff I've been engaged in? Or what are my priorities? Where are my values? And make decisions so we don't have to return to whatever it was exactly the way it was before. There might be opportunities in it for us. And when we think about change as having opportunities, that helps us be more hopeful and have more capacity to look towards what's coming, as opposed to feeling distressed or anxious about what may be coming in the future.
All right, terrific. I have a couple more questions, but they're a little bit off of topic of what we're talking about today. So we will be reaching out to everybody after the webinar with the answer to your questions that you have. But I'd like to take this opportunity, one, to thank Val and Lynn for being with us today. Hit another home run. What you're talking about really, really is, you could feel it when you're talking in your personal life. I think everybody on here sees those things. I'm sitting at home for the 370th day in a row or whatever it may be, and my kids are going through things, my family's going through things, and you really just feel it when you're talking about it, and it hits home. So if you have parting comments, that would be wonderful. Otherwise, we're going to let everybody hit the road and enjoy the rest of their day. So Val, parting comment?
Sure. Yeah, I think for me, I really like what Lynn talked about, which is, really sort of taking this moment as a time of reflection, and to really think about where are your values? What have you gained? Not just what have you lost this year? And what kinds of commitments do you want to make going forward to maintain those gains in your life? And to not judge yourself or others if they don't look exactly how you think they were going to look. I think, again, the pandemic has changed not the world, just the world, but ourselves. And in a lot of ways, that could be just absolutely okay.
And Lynn?
How can I top that? I agree 100% with Val. We're one of the things about any challenge in life is that we can learn from it and grow. It can be really hard, and for some people it's going to be more challenging than for others. But hopefully when we get to the other side, we've learned some things about us that will help us weather the next challenge, because life has storms. We've all collectively experienced this storm of the pandemic. It hasn't been the same for all of us. As my mom has said, or I've heard it from my mom, but others have used this as well. We're all in the storm, but we're in different boats, right? So it's a little different for all of us. But there's some things here that have happened, ways that we've had to be more resilient, to be flexible, to be adaptable. We need to take that going forward as well. The lessons from all of this, allow ourselves time to mourn, to be concerned for what we've lost, whether it's loved ones, friends, family, just opportunities like high school graduations, things like that, but also to think about where we can adapt and move forward. That's what we have to have in order to develop our resilience to face future challenges. So there is that to consider too in the midst of all of this, both for ourselves as individuals, as professionals, and also for the people that we work with.
Great, thanks, Lynn. Nisha, any parting shots before we head out for the day?
No, I'm just to recap, I think that as you said, Mike, a lot of what has been talked about today really hits home with a lot of the things that we're all dealing with on a one-on-one basis. So really appreciate the insights. And as both of you have said, it really is an opportunity for us to look at how do we want to be as human beings moving forward.
All right, great. Thank you very much once again, Val, Lynn, and Nisha. This was wonderful. Everybody have a wonderful day, and we will talk soon.
Thanks, bye.
Everyone.